Hi everyone, Patrick Menninga here, spiritualriver.com. I want to talk to you today about eating disorders and how that can relate to addiction. Now, many times if someone has an eating disorder, that's actually a co-occurring disorder that co-occurs alongside of drug or alcohol addiction with it. In other cases, an eating disorder can be a precursor to drug or alcohol addiction or vice versa. So many times the eating disorder does not occur in isolation. It's not all by itself. It's often paired or a precursor to drug or alcohol addiction of some kind. So it's important to be aware of that and realize that counseling and therapy is going to be a huge part of getting past an eating disorder and or the co-occurring addiction that goes with it. If someone's experiencing both of these, an eating disorder and an addiction, counseling and therapy is going to be a huge part of their recovery. They've got to work through sort of the root causes. They've got to work through what's leading to this behavior to begin with, and they've also got to treat the addiction alongside with it. It's a lot to take in, and it requires a lot of support and a lot of outside help. At the extreme level, when it comes to eating disorders, you're going to want to seek out professional inpatient treatment. You're going to want to go to a facility. This is made easier in a way if it's co-occurring, because then you can find a drug or alcohol treatment center and start there. Co-occurring disorders are difficult because you've got, in some cases, a mental illness and an addiction, or an eating disorder and an addiction, and you can't just treat one in isolation. You have to treat them concurrently, or the one problem can lead you back to the other. So if you're struggling with addiction, if you're struggling with alcoholism, and you also have an eating disorder in addition to that, then you need to go get a lot of help all at once. And there's nothing wrong with that. You just need to understand that all the problems need to be addressed. You can't just deal with one while ignoring the other. You have to figure out how to address all of it at the same time so that you can get your whole life back on track.